Good afternoon, everyone. In the interest of time, while waiting for the chairs to be filled up, I think we might as well start with the session. Please take your seats. Welcome to the event, distinguished guests, development partners, and fellow colleagues. Welcome to this session of Advanced Safety and Sustainable Mobility across Asia and Pacific. My name is Ganesh Kalasam. I'm the Senior Transport Specialist in ADB and the moderator for the session. We are pleased to bring together the government representative, development partners, and experts to explore how the emerging technologies, innovative systems, and data-driven approaches are transforming the road safety and mobility outcomes. In this session, we will navigate the increasingly complex challenges from road safety, public health, to climate change, urbanization. This is an opportunity for us to share the practical insights and the scalable solutions that we have. In this session, we have three main components. One is the presentation. The second is the lesson learned from the panel members. And the third, question and answer sessions. Without further ado, we welcome the panel presentations on the first session. And let me call out the names of the presenters. First and foremost is Ms. Priti, Senior Transport Specialist from ADB, my colleague. Please take your seat on the stage. Johan, Head of Asia Pacific, specialized in road behavior systems. Johan, please, on the stage. Ms. Shweta, Senior Economist from World Bank. And Greg Smith, CEO of IREP. Yep. I would like to invite Ms. Priti for the first presentation session.
Thank you, Ganesh, for the introduction. So I will start, let me make sure my slides are up, with a setting of a scene and a quick overview of some of the themes we'll cover over the next 90 minutes or so. And I'll end my presentation with a teaser of an innovation challenge that we're launching today. There we go. So when we talk about safe and sustainable mobility, what do we mean by that? We mean transport systems that work for the people, that work for the environment, and that works for our economies. We mean transport systems where people can move safely and efficiently without any risk of death or severe injuries. And I asked AI that same question: what would safe and sustainable mobility look like realistically in the Asia and the Pacific? And this is the image that it created. And in some corners of the Asia and the Pacific, we do see infrastructure that looks like this, but most of what we see looks more like this. And as a result, we see this region having the largest share of road traffic injuries and fatalities in the world compared to any other region in the world. And that means that there are 700,000 deaths a year, more than millions more injured, one person dying every minute. And whether you're in Central Asia, South Asia, or the Pacific, road traffic injuries disable and take the lives of the most economically productive people in a country, age 15 to 49, are majority of the victims. And so that contributes to quite a big cost to economies across the region, 3 to 5% of GDP each year. And that this is all the while knowing that road investments that decrease crashes actually have a higher return than those that increase crashes. So this situation puts us quite off track of meeting our 2030 targets to have road deaths and injuries as part of the second decade of action for road safety. And there are many layers to this challenge, but one of the major issues that we've had is that we've been very reactive in the way that we address road safety. We wait for crashes to happen, we analyze the reports, and then we try to retrofit the infrastructure to address the crashes. But technology actually offers us an opportunity to be proactive and to move from responding to crashes to actually managing risks so that those crashes don't happen in the first place or they don't happen at that severity. And no tool or technology can be effective without an approach that it's grounded upon. And for us in road safety, our gold star and our North Star is a safe systems approach. And it's a proven and tested approach in the most high-performing countries in the world in terms of road safety. And the safe systems approach recognizes that a human body has a certain threshold and tolerance for kinetic energy and force that it can withstand before severe injury or death, and that we have the ability and the responsibility to design our systems in a way where when there is a crash, that the energy that's exchanged in the system never meets that threshold. And we can do that by the way that we design our roads, by the way that we design our vehicles, manage speed, and here the health sector has a huge role to play in terms of timely and effective post-crash response. And the entire premise of the safe systems approach is that we as human beings will make mistakes, and those mistakes should not result in a death sentence or a lifelong disability. Oftentimes when we think about technology and safety, we think about autonomous vehicles, but the ecosystem is much wider than that and broader than that. And we actually see technology enabling our ability to implement the safe systems approach. So we see new technology in vehicles, allowing for assistance to drivers in terms of automated braking and lane change assistance. We also see the ability for vehicles to communicate with each other and with infrastructure. In road infrastructure, we have tools that help us design and assess roads before they're built. And we have IRAP who will present more on that shortly. And we also have new tools for enforcement, automated enforcement. We see drones being used to identify risky driver behavior. And we also have tools like geofencing, which allow us to remotely control the speed of cars in certain areas like school zones. And we also have new ways of collecting data and analytics. We have GPS data, we have mobile phone data, we have AI-enabled data. And we also have tools within cars and technology in cars that automatically calls the health service in an event of a crash. It's called eCall. And so all of these technologies can be fully optimized with the right enabling environments like capacity, policy, resources, partnerships to enable its full capacity. At the ADB, we are also increasingly incorporating technology into the way that we design our projects and operations. This is an example of a digital twin that was created, a virtual simulation of a highway that we're looking to upgrade. And then using this virtual simulation to look at, if we install these features, what would the results look like and what would the investments look like? And this project, using this methodology, was approved last year, over a $200 million project, upgrading 87 kilometers of highway in Uzbekistan. And through our TAs, technical assistance, we've also been working on how can we collect more proactive road safety data. And we see here, and we want to thank the High Level Technology Fund for supporting this pilot study, where we challenged ourselves to look for ways to collect road safety data using publicly available information. So we looked at GPS probe data, open source network data, crowdsourced street imagery, and we looked at 3 indicators in the whole network of Thailand and the whole network of Maharashtra, India. And we looked at the road network carrying 75% of traffic, so looking at exposure, the proportion of traffic traveling over the speed limit, and the proportion of two-wheelers wearing helmets. So we trained an AI to take millions of crowdsourced imagery to then detect passenger and driver helmet wearing. And the idea is for governments to be able to hone in into this dashboard and see where the speeding rates are, where the helmet wearing rates are, and be able to prioritize their investments in infrastructure and enforcement. And we also see this being overlaid with other types of transport data and infrastructure data. So building upon that and coming to the close of my presentation is also an innovation challenge that we're launching today, taking that billions of data points that we collected through the pilot and putting out a challenge, taking it a step further and asking innovators to use the data to not just look at the speed of drivers, but to look at whether the speed limits themselves that have been set a while ago are actually still appropriate for the use of the road. So with that, I'd like to ask for the video to be played.
Globally, road injuries are a leading cause of death, with Asia and the Pacific accounting for nearly 60% of all fatalities. We often focus on drivers going too fast, but are the speed limits themselves set at safe levels? Across the region, the mix of vehicles and pedestrians has grown and transformed, but speed limits haven't changed for decades. Under the globally accepted safe system approach, speed limits should be set at survivable levels. The AI for Safer Roads Innovation Challenge is an ADB joint initiative with the International Telecommunication Union, AI for Good, and the World Bank Development Impact Group. We're calling on data and AI innovators to work with real-world data sets to develop a speed safety score that allows transport officials to decide where to act next. The model will assess if speed limits align with safe system principles. Top solutions could earn cash prizes, an opportunity to pilot methodologies with ADB, and global visibility.
Apply by June 25th at challenges.adb.org/AI for Safer Roads.
Thank you, and I just have one more slide. And I'd like to thank our partners, High Level Technology Fund, JFPR, and also the World Bank Development Impact Group that's represented by Sveta here. And just to close out my presentation, through the rest of the session, we will continue to see more presentation of technology that's available to us, and we'll dig deeper into some of these enabling factors that would allow for us to successfully implement and scale the technology so that we can improve the situation of road safety in the region. Thank you.
Thank you, Priti. You gave a very fantastic reality check on the figures and facts and all that. With that, we invite our second presenter, Johan, to present his views.
All right, let me just do this. Hello, everyone. How are we all doing? Very good. So first off, I want to say it's really, really good to be here. So thank you very much to ADB for having me. And thank you all for listening in as well. So I hope you can learn something new today. I want to test the clicker first. There we go. Let me start by introducing myself. Johan Forsike. I work for Greater Than. It's a Swedish data analytics company that is based in Stockholm, Sweden, but myself is based out of Singapore. I've been there for the last 6-7 years and lead our projects around the APAC region. So what Greater Than does is that we've specialized in one thing, and that's our AI, which measures drivers' impact on the road. and it's from two different perspectives. Firstly, it's from a climate perspective, where we measure a driver's climate impact on the road. So how much of their climate CO2 output is based on how they're driving the vehicle. Whereas the second part of our business is measuring the safety or risk of a driver. And what that means is that we're measuring a driver's likelihood of being involved in an accident. This data, as you can probably understand, is being used in a variety of different industries because it's beneficial for a lot of different companies and organizations. So it's been mainly insurance companies, automotive companies, new mobility companies. I'll explain a little bit around our technology and the core of our AI, and then I'll jump through 2 customer cases as well, where our customers and partners have utilized our AI in very different ways, but very unique ways, and I find them both really exciting when it comes to road safety and the impact that it can have, and it's already having as well. So I'm not going to talk too long about our AI, because I can easily talk for 2 hours then, and still my CTO thinks I'm oversimplifying it. So just to give you the gist of it, our AI uses something called pattern profiling. So we've been gathering driver GPS data for roughly 20 years. That's one thing that makes our AI very unique. We only use driver GPS data for us to do our analysis. This driver GPS data has been collected in conjunction with any accident outcome with that data. And we've created patterns out of this GPS data. You can call it sort of DNA strands. So if, let's say, we were to analyze any driver here, and we would analyze your driving, gather that GPS data, create a pattern out of it, and we would ask our AI, hey, have we seen this pattern before? And our AI would respond, yes, we have. The accident outcome or accident likelihood is XYZ. We have data from more or less all over the world, not every single country, as you can see there, but quite a lot. And we have our database consists of 7 billion different driving profiles. So you could say, and this is where my CTO goes in, no, but you could say one driving profile is sort of like one driving style. So talking around our AI and the data that you get from it and what makes it unique. Number one is that we only require GPS driver data. So it's quite cheap and also easy to deploy. So if you have the data available via any sort of hardware, whether that's from a dash cam or telematics device or a smartphone, for example, we can take that GPS data, we can do our analysis. The second part, and that's also something I find really, really cool when I hear Preeti talk as well about how we need to move from being reactive to proactive. And that's how we fit into this picture, by providing data that is predictive. So our core technology, which comes from our AI, our crash probability insights, it shows the likelihood of a driver being involved in an accident. And this is predictive data with the biggest or strongest correlation to being predictive for roughly in the coming 2 months. Secondly, it can be used on any sort of, it's agnostic to vehicle type and agnostic to location as well. So it can be deployed in any country and can be analyzed any sort of vehicle. So it means, in theory, you could measure the absolute risk of a driver, of a truck driver in Sweden versus a taxi driver in Singapore. Though that use case is probably very niched, so I don't think anyone needs to know the difference there. And usually it's put into context to understand, all right, within my fleet, which driver is most likely to be involved in an accident? Or within my fleet, how is my driver comparing towards the average driver within our country, for example? So our technology is available for organizations or companies in many different use cases, and I'll share 2 different now that I found really exciting. So the first one is that we work with Honda in Japan. So they've found a very unique way of visualizing our data. So as I mentioned, our core technology is analyzing a driver and saying, hey, this driver is this likely to be involved in an accident. Whereas for Honda, we've analyzed their anonymized driver GPS data, still analyzed it as a driver, but instead of segmenting or aggregating it on a driver level, we've done it on individual road segments. So we're telling then how risky are drivers driving throughout different road segments. So then you can see different hotspots throughout a city or throughout a region, in which intersections, in which roundabouts, in which just normal road links are people driving extra risky, and understand if there's something, what is inviting drivers to drive more risky here, what is causing drivers to drive more risky here. So it gives operators and organizations a completely new data point to look at when taking infrastructure decisions. And it doesn't only act as a data point to see where we should act and where we should target our efforts, but also as a feedback point. So once you've taken your actions, once you've implemented some sort of safety and initiative in a region, you can see what has the effect been. Has it improved drivers' risk there? Has it maybe increased it, for example? Second customer case that I will be sharing is together with the FIA. I'm not going to pronounce that whole name because my French is not that good, but they, I was about to do it there. We've worked with them for many years and been a very great partners of ours. They found and launched a very unique and exciting project when it comes to road safety. So they've taken our AI and they've indexed the crash probability and the risk insights we provide. So with this, they managed to create a global measurement and global benchmark for driver risk. It's called the FIA Driver Safety Index. So now you can actually see with one parameter how is driver safety, how is road safety actually performing on a global level, and also invites organizations and companies to analyze their data so they can compare how their road safety, how their risk, how their driver safety is comparing towards the global average. And you can also dig down even further, because it's great to understand how you're performing towards the global average, but how am I performing towards our industry average, for example? How am I performing to similar operators or similar fleets? Or how are we performing towards our country's average, for example? So the possibilities there are endless on how you can dig down even further there. And just want to highlight that again, because I think it's really true, and I think everyone agrees here that we're moving from reactive to predictive safety management instead, and to help with smart infrastructure planning decisions, and also to provide comparable safety and sustainability metrics. It's a lot easier to change something when you can also measure it beforehand. So with that said, I hope you enjoyed my presentation, and thank you very much.
Thank you, Johan, for your very good presentation. With that, we would like to invite our third presenter, Sweta from World Bank. Over to you, Sweta.
Great. Thank you so much. I'll just wait for presentation to be up. Perfect. So good afternoon, everyone. I'm excited to have the opportunity today to present on how we can use data systems and a data system approach for more effective targeting of our road safety interventions. This is coming from the point of view of iConnect for Impact, which is our program of transport impact evaluations, working with governments to innovate in how we generate useful information to support better investments and more impact from our transport investments. We work across the world, and we also work across sectors. Specifically, we have a lot of work in the road safety space that I'll be presenting today, and I'll focus today on one example from our work in Kenya, with the idea that this could potentially be applicable across the world, and especially across the countries here represented from Asia and the Pacific. So when we first started working in Kenya back in 2015, the government reported around 530 fatalities, a little over 1,700 crashes in the city of Nairobi. That not only was most likely an underestimate, but also we had no other information. So the government agencies were starting with this blank map of Nairobi with over 6,000 kilometers of road where they needed to think about how they spend their resources and where they need to be putting in interventions. And so we wanted to work with them to see, well, how can we bring in data to address this challenge? And I think many in the room are probably facing the same question of where should we be putting our resources to be most effective? So the first place where we started was with the typical administrative data. And like probably many agencies, that data in Kenya, Nairobi, was in stacks of paper records, which are not very useful. So we worked with the National Police Service to turn those stacks of paper into useful data insights. We scanned and digitized over 10,000 police reports going back to 2012 for all of the police stations in Nairobi. We identified the key indicators from those reports using machine learning algorithms to help us in doing that much more quickly. And then that could help turn that information into an actual map. We could now see where these crashes are happening, what are some of those characteristics of the crashes. But we knew that administrative data is going to be missing some of the information. It's not going to capture every single crash in the city. And so that's where we also want to explore new ways of bringing in data. And we looked at crowdsourcing that information. So in Nairobi, we worked with Twitter, and specifically focusing on one Twitter handle, I guess X handle, X now. When we started, it was Twitter. And we scraped over 850,000 tweets where people were messaging about crashes that were happening, basically to inform their fellow commuters about those crashes and potential congestion that might be generated because of that. We then developed a machine learning algorithm that allowed us to turn the information from all those tweets into, again, a useful map of where people are reporting crashes. First, we identified which of those tweets were related to a crash that had happened. And then once we had that, we could look at the text in the tweet and identify the location where people were reporting that a crash had occurred. And this allowed us to generate information on crashes across the city with over 30,000 crash tweets that we were able to identify. Additionally, we wanted to bring in other types of data to understand the characteristics of the crashes and the high-risk locations that we were identifying from that crash data. So we brought in data from Google Maps, scraping average travel speeds to allow us to look at how speeds are changing along different roads. We also looked at weather, since we know weather can actually be an important factor of crashes and crash risk. Also looking at land use, so knowing that there's a school, that there's a market, all of that provides incredibly important information for policymakers as they're trying to understand what types of interventions might be needed. Also bringing in data from Waze on congestion, so all of this provides us with a picture of what might be happening. And we can combine that information, again, leveraging machine learning algorithms to look at topologies of crashes. So we did that specifically focusing on the pedestrian crashes and using an unsupervised machine learning algorithm to cluster those crashes based on their different characteristics. And we could see that there's different groupings of high-risk locations. In some places, it seemed like there was a lot of high speed involved. In other places, it was that actually there were a lot of pedestrians. There's a market, there's schools. And this tells us that we need to be thinking about different interventions in those different locations. It's not a one-size-fits-all. And so when we can use data to help inform what kind of interventions are needed where, that can help us to better use those limited resources. And so that's exactly what we were able to do together with the government agencies in Kenya. We saw that, we went from that blank map of the whole city to now seeing that 5 roads in Nairobi County accounted for 1/3 of the fatalities. Additionally, over 50% of those crashes involve pedestrians. So right away, that tells us when we have very few resources to be allocating towards this challenge, where they're going to make the biggest difference, and also what kinds of interventions we may need. This is helping to feed into Kenya's National Road Safety Action Plan to support more targeted and effective solutions. It's also feeding into new projects. So JICA has a new road safety project, and the data we've collected as well as the methods are helping to support that project and that work. And this is one important piece, is that when we collect this data, it's not about collecting it for a single project or for a single answer. It's about supporting a whole system of how we're making these decisions over time and supporting different operational projects that we're implementing, planning, and designing. And so in this way, key takeaway is that better data can inform both the policy planning and also thinking about the targeting that can help us achieve higher impacts. Additionally, once we have this data, once we have these data systems in place that allow us to collect data in real time as it's coming in, we can also be able to react much more quickly when things change that were unexpected. For example, during COVID-19, in Kenya, as in many other countries, there were mobility restrictions put in place. In particular, there were curfews. As you can imagine, when you change mobility, that's going to have an effect on road safety. And so because we've been collecting data over time, we could actually look at that as it was happening. So looking at that Waze data that I mentioned, we could see how congestion is changing over time when different policies were put in place. Importantly, when we think about a curfew that is very strictly enforced, where people are having to get home, an important aspect to think about is, well, how's that affecting their behavior? In particular, speeds. And what we see is in those hours, right before that 7 p.m. curfew, all of a sudden, people were driving much faster because they had to get home. They had to be there so they don't wind up getting in trouble, they don't get fined. And so with that, we're seeing that riskier behavior, and now we're also seeing increases in crashes. So overall, when you look at what's happening to crashes, there was a decrease during those curfew hours because no one is on the road, but in those hours right before the curfew, we see a large spike in the crashes. And so when we have this kind of data available to us, we can actually see this happening. And obviously when these policies were put in place, no one was thinking about road safety, but different policies can wind up actually affecting what is happening on the ground. And so we can be able to do something about that and potentially change those negative externalities and mitigate them so that we're not ending up in this situation. And so if we invest in data systems, that can help us to address those unexpected things. And finally, this has now been mentioned a few times, but a lot of what I've been showing is reactive. So we're looking at, well, where are crashes happening? How do we address that? But I agree that we want to be moving towards more proactive. And so that's where we've been looking at using AI and video analytics to help us understand high-risk locations and what might be leading to crashes in the future. And so we use video footage from CCTV cameras to study behaviors and near misses. So a crash hasn't happened, but it's almost happened. A car almost hits a pedestrian or almost hits another car. And when you look at that happening over and over in certain locations, that tells you that this is an area where most likely there will be crashes in the future. And so you can think about what needs to be done so you can prevent those from happening in the first place. And so final key takeaway is what we can use this type of new technology and analysis to help enable proactive action so that we're not waiting until the crash happens, we actually stop that crash from happening in the first place. So I'll leave you with 4 key takeaways. Hopefully I've convinced you that unconventional data sources exist everywhere and there's new ones coming up every day, and we should be making use of those. In particular, machine learning and AI can help us to process that new data, because just because the data exists doesn't mean that it's actually useful. You have to turn that data into useful policy insights. And so that's where we can do that now much more quickly, especially as the amount of data coming in is now starting to be massive. Additionally, there's strong potential for transferability, for adapting some of these interventions in other places. I've obviously been giving the example from Kenya, but as I said, probably many agencies here are working with paper records. We could think about how do we turn those paper records into useful information? How can we leverage other types of data to support the work that you're doing to be able to decrease crashes on the ground? And finally, I hope that I've convinced you that if we invest in data and we invest in implementing data-driven solutions, that could help us to use our resources to be more effective, so that we're actually able to do much more with those limited resources and are able to much more quickly achieve our goal of reducing crashes and reducing fatalities. So thank you.
Thank you, Sweta, for your good insights. With that, we invite our final presenter, Greg Smith, the CEO of IRAP.
Good afternoon, everyone. Thank you for taking the time to join this session. I'll just wait for my slides to pop up as well. That's the last one. I'm going to go right back to the start. Okay, so my name's Greg Smith. I'm from the International Road Assessment Program. I'm going to talk through a little about what we're doing to improve our methodologies and tools that are available around the world. I think there's going to be some similar themes as the previous presentations. So just about IRAP, it's the International Road Assessment Program. We're a charity set up in the UK but actually operating globally. So I'm, for example, living in Vietnam right now. What do we do as a charity? We make the methodologies and tools that we've created freely available for use around the world. So those tools are now used in more than 100 countries around the world. Millions of kilometres of roads have been assessed using the tools, and particularly doing the star ratings of roads, where the highest risk roads are 1 star and the lowest risk roads are 5 stars. More than $130 billion of road infrastructure projects have made use of the tools. So they're very extensively used and having very successful outcomes in projects in terms of driving road safety. But one of our questions, and this is kind of our moonshot project in our organization, is to say, what if we could create a star rating for every single road on Earth every single year? How would we go about doing that? What would be the benefits of doing that? So as I said, so far millions of kilometres have been assessed, but that's just this small fraction of all the roads around the world. We know that most of the traffic and most of the deaths happen on a small percentage of roads, like Sveta said. It's very common to have 5 to 10% of a country's roads accounting for more than 50% of deaths. But nonetheless, having intel about the infrastructure level, safety level for every single road is incredibly interesting and I think compelling. For example, we know that every single road is managed by someone, a road agency, whether it's at the local level, district, city, or national level, or provincial level. Having some sort of intel, and like Sveta said, some sort of mechanism to take all the data that's out there in the world and add intelligence to it and insights that's actionable for everyone, I think is incredibly a powerful argument. But also, it's having that sort of data and that scale of data introduces some new ways in which it might be used. So talking to Grab and rideshare operators, if they know that there's intelligence around about the star rating of every single road, they can start to use that in their route planning for doing trips, helping to decide not only which is the fastest and the cheapest route, but which is the safest one for their drivers to take. But also another use case, and we were discussing that this morning at the Public Works and Highways Department here in the Philippines, is when they make an upgrade to a road, they're very interested to make sure that the star rating of the road is improved. But going out to that road, measuring the data, doing the assessment, producing the star rating takes time and effort. Is there a way for us to accelerate that so that if we are able to produce star ratings each year based on data around the world, automatically that you're getting some insights into the evaluations of the work that's going on around the world? So traditionally, an IRAP assessment is done by getting a video of the road and literally manually recording what you see every 100 meters and recording maybe 70 different attributes of the road that we know influence safety. But increasingly, we're seeing that the opportunity is there to use the existing data that's everywhere, bringing that together, mapping it into the IRAP specification, and then using that to produce star ratings. So rather than just relying on images collected and human beings doing the coding, we might be able to map road asset and inventory databases, use probe data from vehicles, satellite image data, LiDAR images that are data that's being collected for other purpose. So very much finding ways and I guess leveraging the technology we have with AI and the opportunity with AI to accelerate this process to make it faster, more reliable and more repeatable, and also very much more scalable. So part of that initiative has been an effort on our side to think about actually our methodology is very detailed. It includes 70 or 80 different attributes that need to be measured. What if we simplify that, allow sort of the resolution of a star rating to be reduced a little so that the AI is better able to match up data that's available with our specification, with the idea that over time you then are able to improve the resolution of the star ratings. So what you can see there on the table on the left-hand side is all the attributes that get recorded in an IRAP assessment on a road every 100 meters. So in a low-resolution star rating, instead of collecting all that data, you might just rely on the ones that are in green to give you at least an estimate of what the star rating is on a network. And the benefit of that, of course, is that it needs less data, it's simpler to do, and much faster. But fewer attributes are recorded, so fewer insights about what you might do. Then obviously you can progress to a medium level resolution of star rating or the full resolution star rating. I should just say those images on the right-hand side I asked AI to produce. I'm not very happy with them, so they're not the best images. So yeah, AI also, needs to be supervised. Sometimes it's a little crummy. But I think you get the idea, is that we're trying to think about ways that we can gather as much data and bring it into the IRAP context, but also ways that we can bring the model closer to what the AI is capable of right at the moment in terms of a simplification. So these are some of the tools that we're working with right now to try and help accelerate this, and these are tools that are going to be available later in the year. So one of the questions we have from countries is, I don't have any data in my country at the moment, but I need some guide or some guess about what the star ratings of my road network as a whole might be to help with policy setting. So what you can see here is the Rapido tool. So it's a sort of module within the free VIDA software, and it enables you to construct your road network piece by piece based on, for example, how much of it is generally urban, how much is rural, of that, how much is divided or undivided. Use your design standards, use sampling to construct that process very quickly. So you start to build up a picture of your network and start at least to get a rule of thumb estimate of where the star ratings might be at for your country. So you can see as it's being constructed, that pie chart there is sort of telling you the descriptions of the section of road, and on the outside, those colors are the star ratings of those different sections. And as you'll see in a moment, you can look at that for different road users, whether it's vehicles, motorcycles, pedestrians, or bicyclists. So very, very quickly, you can do a ballpark estimate of what the star ratings are likely to be in your country. So there you can see it's changing the different road user types. The second component of that is to then take that approach and also look at corridors of road. So instead of thinking about every 100 meters of roads, we need to do a separate star rating, starting to think about the stereotypes, so the consistent segments of road. And again, it's a tool that makes full use of the full IRAP methodology, but just helps you to accelerate the application of it, so you're starting to get estimates of the star ratings. So in this case, you can see a section of road, maybe it's got some urban, it's got some rural. You'll see in a moment where you can select the different stereotypes or the different road attributes. So this is an interface in the IRAP software, which is, again, freely available, that means you can greatly accelerate the way that you do your estimates of the star rating. So, for example, if someone asks you to do a quick star rating of a design that's being concept designed for a 100-kilometre section of road, literally within sort of 10 or 15 minutes, you're going to be able to get a quick estimate of what the star ratings are likely to be based on the key attributes. And again, this is able to be interfaced with some of the efforts that we're making on the big data side to bring together data sources from road assets, from satellite images, from image recognition, and so forth. So these tools, these new Rapido tools, will be available later in the year. But just to say that we're, in terms of this light star rating approach, we're increasingly seeing it being applied around this region. So just on Monday, I saw a presentation from the Thailand team, who've now done 108,000 kilometres of star ratings for the entire national network in Thailand, using mostly from their road asset database. And the thing that's making that very much more possible is ChatGPT or Copilot is getting very good at doing coding in Python language, for example. So it's able to help us map very quickly from road asset databases into the IRAP specifications, literally in a matter of days. So these tools are freely available for you to help accelerate your work in terms of planning infrastructure safety, monitoring infrastructure safety, but informing discussion about the right level of investment that is needed in infrastructure. And just to finish, our modelling shows that if most travel on the world's roads was 3 stars or better, there'd be about 400,000 fewer deaths and serious injuries each year, and a saving of about $1 trillion in terms of crash costs avoided. So there's a very strong investment case for improving the safety of infrastructure around the world. Thank you very much.
Thank you, Greg, for your excellent presentation. With that, we have concluded the first component of our session. We kindly now request the presenters to take a seat at the front row. You'll be called back during the Q&A sessions. Distinguished guests, we're coming to the most interesting part of our session, the sharing of real-life experiences by a group of our panelists. With that, may I invite the following panelists to the stage. First, Ms. Priti, she's already here. No need any introduction. My colleague, Senior Transport Specialist from ADB. The DG of Road Development Authority of Sri Lanka. Yep. The Director of Health ADB, Eduardo. The Head of Assets and Climate, TRL, Colin. Yep. And the Chief Corporate Affairs Officer, Grab, Boeing. So with that, I hand over the floor to my colleague, Priti. Thank you, Priti.
Thank you, Ganesh. And before we get started in the panel, I wanted to pull up a Mentimeter just to get everyone awake from the food coma that we see here. So we do have a Mentimeter. If you can get out your phones, so we can get an idea of what everyone's thinking in terms of technology you believe could most transform road safety over the next decade. So we'll keep this up for a couple of minutes, and then at the end of the session, we'll look at what the responses have been. So good afternoon again, everyone. My name is Priti Gautam. I'm Senior Transport Specialist and also Road Safety Lead at the ADB, and a warm welcome to the panelists here today. Thank you for joining us and enriching this discussion on where technology and innovation can take us in the region. So we've heard about some of the innovations. We've heard great perspectives about the opportunity that it provides, and now we'll focus more on how these technologies are being applied across the government, private sector, also the health sector, and research institutions. So with that, I'll first start with our government representative, because ultimately this is where these tools need to be useful. So DG, Director General Hittiarachchi, if I might start with you, Sri Lanka recently launched a new road safety strategy, 2-year road safety action plan. So congratulations on that big step. And within that plan, we've seen a very forward-looking ambition to include AI, innovation, new analytics. Can you tell us more about Sri Lanka's ambition in this space and how you see technology helping you with your progress in road safety?
Thank you very much, Preeti. First of all, thank you for the inviting me for the this forum, and also have a good day for the all audience. First thing is actually we have launched that action plan, road safety action plan in 2025 to 2026 in last year. Actually, the issue we have identified is we have a poor data system. That means we have data system, but the data system has not shared with others. That means for example, the police has the some data system, the accident data and others, the DMT, that means Department of Motor Traffic, has the some system, but these are for example. However, these are not integrated in such things. I think it is very difficult to take decisions how to integrate, and these are independent. That's why that sort of issues we identified. That's why this type of road safety action plan integrated, because we have the accident rate of more than 14% per 100,000 population. That means it is a high risk. So it has to be changed. That's why we have introduced that.
Thank you, DG, and it's really great to see a government incorporate technology and identify these gaps and opportunity for technology to integrate into the framework. So thank you for that. I'd like to move over to the private sector now. And Bowie, you are the Chief Corporate Affairs Officer of Grab. And Grab is one of the largest mobility platforms in the Asia and the Pacific. And you've been rolling out a lot of technology and AI into your operations and at scale. Can you tell us more about some of these innovations and what type of outcomes you've seen from integrating safety? And are there any other new exciting technology that's ahead?
Hi, thank you for the question, Preeti. Good afternoon, everyone. So I'm Bowie, and I'm representing Grab in this panel. So first, let me begin by saying, for us, safety will always begin with the driver. So it's always driver-led, but having said that, we do have a two-pronged approach to safety. It is driver-led, but technology reinforced. So safety starts with the selection, training, setting of standards, and accountability for the driver. But on the tech side, we do use AI and machine learning to monitor the ride, to identify any risks along that for that particular ride, and the ability to respond if there's any assistance needed for that particular ride. So what are the AI and machine learning tools that we're seeing? So first, we deploy them to monitor the driver behavior. You mentioned that fatigue nudges. So we do send out an alert if a driver has been driving for 10 hours for a two-wheel vehicle, so that's for delivery, that's for passenger hailing, and 11 hours for a four-wheel vehicle. But I would have to say that the fatigue nudge is based on the total online hour of the driver. So we are still working on differentiating whether in that 10-hour period, was the driver really driving for 10 straight hours, or there were certain rest periods in between, so that we could be more intentional and it's more directed. The fatigue nudges are more directed. So for example, a delivery rider doing, say, 7 back-to-back deliveries during the lunch break. So so that we could remind them, hey, maybe it's time to take a break. So that's what we see. Also on driver behavior, we do send out overspeeding alerts relative to the speed limit for that particular corridor. But of course, right now, it's good to hear that we are also, I mean, in your presentation, the review of speed limits in corridors, given the mix of vehicles and pedestrians, should be done. And it's something that we would be happy to partner with government on if we do need to review the safety limit, the speed limits that we've set in the app. So that's one. So that's another feature. We also use AI and machine learning to detect black spots during that particular corridor. So is there any, was the area been flagged because there's a sharp curve? So AI can detect sharp curves by the sudden braking of the drivers, and we see the data. And so once we've collated enough, drivers are alerted, hey, on this particular trip, there is a sharp curve happening, so better slow down before you hit it. So these are the instances or that we use AI and learning. And it's so interesting that when we shifted to these proactive interventions. So I see the theme of the panel presentations from reactive to proactive through the use of technology. So we are using that, and when we employed these proactive modes, we saw a 10% decrease in incidents per million rides year to year. This is 2025. So for this coming 2026, of course, we are continuing with these interventions, but building the safety, not just in the app, but also in the vehicle themselves. So this is what we're seeing in the horizon, given that we're getting smarter and smarter vehicles. So in April, just of this year, during our GrabX, this is our AI product launch event in Jakarta, we actually launched our driver AI companion. This is a voice-based smart companion that enables the driver to manage the app completely hands-free. So we've just launched it in April, not yet rolled out in all of our markets, but we expect that this will be rolled out soon. So this is another aspect of building safety into the app. But given that theme of how do you lessen driving distraction? So we do acknowledge that drivers still need to use the app, right? Like in navigating the route, for example. So what we're building this year is an integrated cockpit. So smarter vehicles have dashboards, and then we're working with these vehicle manufacturers to put the safety alerts directly in the line of sight of the driver to lessen the driving behavior. So that's one happening. Watch out for that, perhaps in the next year's AI event. And another intervention that we're very excited about is our collaboration with May Mobility on advanced driver assistance systems, that brings the predictive reasoning to the vehicle to detect hazards on the road better than drivers can. But having said that, again, we still believe it's driver-led. It's not to pass the driver responsibility for safety to technology, but using technology to reinforce safety so that every ride is proactive and safety is embedded in every ride. Thank you.
Great, thank you. And it's a good example of doing dynamic risk monitoring and seeing outcomes right away from those types of tools. Thank you for that. And I guess building upon data, Colin, you work with TRL across many countries, across infrastructure and data systems, and TRL has IMAP, which is a crash data system that many different countries use. And part of the challenge is collecting the data, but another part of the challenge is actually analyzing the data when you get them, right? That requires quite a technical skill. TRL recently integrated AI and natural language processing into your IMAP data system. Can you tell us briefly about how this function works and how you see this function having the potential of, again, turning reactive data to more predictive and proactive data?
Yes. So yeah, I'm Colin. IMAP has been a product that TRL's had since 2018, and this year we added AI component to it. Purpose of that is to do 3 phases. The data input, so when you get information from the police forces and even the hospital data that we can collect in there, it can look at the data, validate it, tell you if it's correct, compare it with all the other data sets that we've got from people's information, like road asset management systems, like speed limits that are published, how drivers have been behaving, and validate that data and have that in their system. Then the next stage is the AI queries, and it's using human factored language. So children these days no longer really remember facts. They remember the search parameters that they use to find that fact on the systems. As long as us as users and people who are slightly older in our demographics remember how to actually interrogate and ask the right questions, you can therefore start using human language to identify the information you need. Priti, you were talking earlier on about safe systems. You can start actually asking the system to start categorizing the accident data, whether it's from hospitals, whether it's from drivers, whether it's from connected vehicles, whatever you want from a whole data marketplace that can be added into these systems now. You can say, give me, where is it vehicle problems? Where is it going to be actually a vehicle problem going up a hill where there's been poor braking or poor gear maintenance? Can you tell me where it's been poor speed limit management by either the road user or by the infrastructure itself? So as you talked about, can the drivers know about the speed limits they're in? And in UK, we've just done a whole speed limit review to rationalise as part of the safe systems to get the right speed limit for the right network. So rather than just a default bespoke in the UK, we are miles per hour, everything was 30 miles per hour. Whether you're passing a school, whether you're going along a main road and things, that was just a historical thing that's happened, a legacy thing. And it can help us now understand, actually, is that an appropriate speed limit by asking the AI questions about it. And then we've talked about predictive stuff going forward. So we have, in the third component, actually doing predictive stuff. So looking at not just the road network where the people have IMAP. In London, we have a number of boroughs using IMAP, and they can share that data anonymously and say, right, compare it with another borough. It's very similar road networks, very similar needs. Have we got more accidents than the other borough? Can that tell us information that we can improve from our systems? Again, you can ask it to categorize it by safe systems. We use connected data as well from Scoot systems like traffic signals. We've got what's called a data marketplace. We have Mercedes-Benz vehicle data, so you can see where sharp braking occurs. Anybody can actually just have their APK, their data published on this data marketplace. So users, which is predominantly the roads authorities, the people who are accountable for the roads, taking that data and can use it to actually predict stuff. And our predictions now, you can run about a 5-year model using traffic volumes, traffic speeds, user types, and start predicting about who is going to be at risk, where is it going to be at risk, is it infrastructure, is it the speed, is it the vehicle, and start categorizing it.
Thank you, Colin. And I think that the importance of taking data, analyzing and using it for decision making, and also integrating it with other systems is really important. Now, I'd like to move to the health perspective. Dr. Doro, thank you for joining us. As you know, the transport sector is responsible for preventing crashes from happening. But when they do happen, it's a health sector that bears the burden. And we also hear so many exciting things about the health sector and innovation. Can you tell us about some of the exciting innovations that are happening in the health sector and how we might be able to use some of those to bridge transport and health?
First, allow me to thank Grab, because every time I order in Grab food, by the time I open it, my app, it already tells me what to eat. So it makes me afraid, right? It makes me afraid. And frankly, what the RL is saying is actually the fact that they're capturing hospital data is accurate, because that was supposed to be my answer to the next question, but now I think you preempted me. But nonetheless, what we've been trying to do in health is basically try to bring care it's like outside the hospital, and try to bring it as near to the community as possible. And it's because partly driven by I don't use the word artificial. It's so fake, right? I call it augmented intelligence. So whenever I see AI, it's augmented intelligence. And of course, I always claim that the first AI is the Doctor in Star Trek, right? So those of you who are old enough, okay, before they have it, right? Let's not talk about HAL, okay? But in a sense, it's really augmenting. And that's a lot of things that we're doing right now. We're now working a lot with portable X-rays because it's something you need to respond to trauma. And if we could actually bring them, that can be done now to more lower level facilities, then you could actually don't have to, that will cut down the time where you could bring somebody who has an accident to a facility. You could actually empower lower level facility. In Sri Lanka is some of the best with primary care facilities. So they could actually now manage some of the level of trauma without going to the hospitals. So this is the kind of augmenting that we're working and supporting a lot in health. And it's not just diagnostic, it's also the skill set, because one of the problems we always know is, although you're in the Philippines, the land of the nurses and the health workers, there's always a lack of health workers. And part of the need for us to sort of bring scale up capacity, because we cannot produce all the doctors or nurses because they all go to UK, right? And by the way, congratulations to Arsenal. So I hope there's no accident right now in North London. Is that so we could if we could actually empower, for example, nurses to do a lot of the skill set that you need a doctor, that's already a great, and so that's the kind of thing that we're doing in the health sector. So lots of work, different levels. Now, response team, but you also need to have response team. And fortunately, in a lot of countries where we work, there's still 911 is still a TV series more than an actual reality. So we're actually trying to see whether we could jump that, because part of the problem with having 911 is too expensive. It's actually designed bluntly. That means you put a system and try to respond. So having a augmented intelligence actually will allow, and there are now samples in the Philippines, believe it or not, there are 911 systems in the Philippines that can manage the traffic in Manila, Cebu, and Davao. So those of you who know the Philippines, I live in Parañaque, so I'm a master of traffic. 1.5 hours coming here, 1.5 hours going back, right? And I manage it by watching Netflix. I have a driver, so basically that will, and so that the difficulty and it's not just a Philippine problem. It's a problem of large cities, Jakarta, even Colombo now. So we're trying to see whether this is something that we could work on. Finally, I think we need to share data. So I love what you said, that hospital data are being used, but unfortunately, we've been supporting health people. We haven't seen all of the wonderful data sets you've been being part of the discussions on where to design hospitals. In ADB, we love to build roads, right? Sometimes hospitals, not too much. But I've been telling the transport people, instead of having 7-Elevens in the highways, why don't we put clinics, right? So or gas stations, right? Put all the highways, you put gas stations. Because if we start doing that and design with our transport colleagues, then that can actually make healthcare more accessible, and that can actually reduce the time to take care of accidents. But that's something we pretty can talk about some other time. Thank you.
Yes, thank you. I look forward to exploring that and working closer with you on that front. So we'll move back to DG now, and talking about technology that has worked in Sri Lanka. What technology have you introduced in Sri Lanka that has worked and at scale and has been impactful? And what were the factors that enabled it for it to be adopted and scaled?
Yeah, Preeti, actually, we have already introduced the CCTV surveillance and the infrared speed detecting cameras under the prevailing law. That means we can enforce still with the prevailing law. However, with the introduction of other things, something like the CCTV detection and other things, we may have to change our legislation. And also our system has to change, because earlier I told that our different institute have different data system. These everything has to be integrated. In such context, I think we may have to apply new technology for that. For example, the AI technology, we have seen that how to apply that, and these things we have to apply, because otherwise we can't properly introduce this our what we originally launch accidental prevention the program, because the still we have collect data ad hoc from place to place, and for example we can't exactly say what is the black spot, the dangerous location in the road. For that we have to we are considering only the police data and the accident data, but we have furthermore to get details. However, these things cannot be taken at right now. It is a complex situation. So with this integration and the legislation changes, we can apply these things. I think these are the things we have to apply.
Thank you for sharing that. So we'll talk about enabling factors, governance, capacity that's required for you to fully take advantage of the technology that's available. Thank you for sharing that. Buoy, the Grab, you mentioned some of this. You have so much mobility data. I mean, can't even imagine how much you must have. Is there opportunity for development partners and other institutions to work with you and platforms like Grab to use this data and take some informed action and support for countries? Is it also possible between Grab and the government? And are there any examples where a partnership has been successful?
Yeah. So for Grab, we do see road safety as a shared responsibility by everyone. And we do see a role to play by sharing our anonymized, technology-enriched insights to potential partners. We used to have a data sharing with World Bank, very early days of Grab, for a road safety project. We used to have a platform that we put together for use of national and local governments for traffic purposes for monitoring. But I was telling Pretty earlier that our experience has been the capacity to use such data sets then was not there yet. So these platforms have been shelved, but as we always say, Grab is committed to Southeast Asia and the communities that we serve. So we're very open to exploring partnerships on how we can share the data we're collecting on a daily basis, right? So right now, no existing partnerships except for one, our commitment to United Nations for the road safety agenda. We also have a partnership with the Ateneo Bulatao Psychology Services for them to come up with a behavioral module. So we were talking about how we can use data for road safety, but I wanted to highlight this partnership with the Ateneo because we're using the same set of data for behavioral shaping and nudging. So for those in the Philippines, you know that we have a lot of motorcycles, and there's a common term for motorcycles. We call them kamote. So if you're local, you would know that. So, and we do recognize this problem. That's why we partner with the Ateneo to sort of put together a behavioral module that would make them follow the road traffic signal safety rules that we have, because it's very common in the Philippines that because they're small, they think they can just do a counter flow in the road. So these are the instances that we're giving our data to Ateneo, make them understand why do they do such things, right? Why do they feel that they're exempt from the road laws and regulations that we have, and for them to understand that they need to follow. So right now that's what we have, but yes, happy to have a conversation on how we can use our data to promote road safety. Thank you.
Okay, great. I think I've heard of some governments also getting the data for congestion purposes and to manage congestion. So maybe there's a way that we can also optimize in that data availability. Another area where technology is rapidly evolving is around resilience. We've heard a lot about climate and resilience and technology being used for that. So Colin, if I head back to you as the head of assets and climate at TRL, we know that road safety is deeply linked with infrastructure quality, and climate is affecting that. What are some of the tools that are available now that we might be able to, I think you mentioned some of those, integrate and use to also improve road safety? How can we link it more with the climate agenda?
Yes, so go back to square one on your very first words, Priti, this afternoon about safe systems. So looking after infrastructure is not just about the roads and the physical materials, but it's the users of it as well and the environment it's within. So for me, with climate and an environmental element to this as well, is understanding all these impacts on road safety. So are our roads with giant heat islands and people, the users using it, are they getting enough hydration for the user, the actual drivers on the network with extreme heat? Are they causing a problem to the actual system itself and the road users? We've got technology within TRL and within the world to manage our assets a lot better. The first known collapse of a bridge due to extreme heat was about 10 years ago in America, where a steel bridge expanded and it collapsed off the bearings and created problems. And we've known that's going to happen for a lot further on, and it's going to happen as more of our aging infrastructure gets subjected to extreme heat and events like extreme rainfall. So we've got the predictive stuff. We've got structural health monitoring systems that we can put on bridges to actually predict with weather forecasts about where there's risks and put speed limit restrictions in. My colleague, Dr. Workman, is working on scour monitoring. We know you can use satellite imagery to determine where scour has happened on the sides of embankments and roads. And the beauty with satellites is you can go back in time and look at it, what it was in the past, so you can understand what it is current day. So it's not having to wait for data to come through. You've already got the data there. And similar with landslide data, you can, all the sensors in the world now you can put into the ground to monitor movement. That's how to predict things. We've also got to manage climate now on our networks as it is. A good tool that most authorities have is ITS, information to the road user, advising them of extreme rainfall, advising them of journey time delays and things, so they're not pushed to make that journey. They know that if there's extreme rainfall coming, they can either delay their journeys, or if they're undertaking it, to advisory and nudge commands saying, take it slower. As you said, Buli, you can advise your drivers when you've got bends coming up on the roads network and things. You can also advise it when they're slippery, when wet, and the extreme floods. And you can do alerts to the radio and the communications, and people understand what they're doing. And then the final bit about mitigating it for our infrastructure is actually trying to remove some of the carbon and reduce speeds and reduce the energy that's going into the skies and into the atmosphere that's creating this information. It's a long-term repair that. That's better road surfacing using less materials that reduces carbon. And that removes of the emissions. But again, ITS can help with that in immediate terms about managing traffic flows. We've got active speed management within the UK now that manages traffic speed, so you don't get congestion, the bunching up, and accidents happening from that, because crashes aren't green. It's one of the key things we said. It affects delays, it creates congestion, it can harm communities from loss of work and things like that. And as a climate impact, it's quite significant. So there we go.
Thank you. I think ITS has a lot of opportunity, but how can we phase it in the Asia and the Pacific region where that might not be possible, but mobile phones could be a good way to give those notifications. Dr. Dodo, coming back to you, and this goes to one of the DG's points earlier about data and how everything is quite fragmented across transport and in health. Do you see new tools available where we can see that being addressed? And the second part of my question is more about ADB and how we work with countries to get them and governments to help them be ready to utilize and take advantage of the tools available. And recently, ADB through the health sector has had a technical assistance about 1 million, right, to assist AI adoption in Pakistan, Bangladesh, and Indonesia. So, how are we working with countries to support on that capacity side, on that governance side, that enabling factor side? So 2 parts of my question to you.
I'll probably start with the fact that I got invited to a transport forum. So for me, that's already a sign of collaboration between health and transport. Because unfortunately, I don't know, besides your doctors, I don't know if you know anybody who works in the health sector. Now, unfortunately, that's also how it is in lots of governments. Lots of the data by transport. So let's use the Philippines, my favorite model, because I'm Filipino. Right, I don't think the Department of Health in the Philippines have access to the Metro Manila Development Authority who controls the data of traffic. I don't know whether they cause the traffic or the data on transport in Metro Manila. The Land Transportation Office, including who do a lot of drug testing on individuals, don't even share that information with the Department of Health. But the Department of Health supervises the laboratories that's supposed to do the drug testing, but they don't talk to each other what happens with the results. So in a sense, and historically the problem has always been because a lot of the information was in pen and paper. Technology now means it should no longer be a problem. Both sides have been really moved forward with digitalization. That's why we now talk about AI, because it's a lot of big data. We used to call it big data, we now call it AI. Who knows what we call it in the future? So in a sense, now it's much more easier to have that. And of course, in the Philippines, there's eGov, if it functions, the website. But in a sense, there's a lot of countries that are actually combining a lot of the digital data that they have from different parts, and we're seeing that all over. And within health, because health is also notorious for having silos, because health is probably one of the most fragmented sector, because every donor wants to give something, right? There's TB, there's vaccines and all of that. There's now a lot. So the fact that there's a lot of data that is now being data converted, sorry, I've been repeating that, that actually helps a lot. And the sharing is something that can be driven by policies, and we're seeing that. And so once we have that, then I think then we could hopefully get all the data that you have in health and make it part of the decision making within Ministries of Health or Department of Health. Now, one interesting thing, I just want to jump, is that in health, we're actually doing a lot of work also with satellites. So within ADB, there's a project we do looking into heat maps. We're working with the European Space Agency, they're not here, and they're now helping us map and so we just did one in Pakistan. And so I think this is something interesting we could work on, because heat maps can also be something we could use. If we have more of the satellite data, that can also allow us to make decisions on how to build new facilities, make decisions, insurance coverage and all that. So there's a lot of things that can work, and satellite data is something great. Now within ADB, so in a sense, our mandate is really to work now closely with different sectors. So we actually see really whenever you talk about your slides earlier, the colleagues here, those did the presentation, they all say deaths and accidents, right? So at the end of the day, it's a health thing, right? So the more that we get to quantify, what are the impact on deaths, the impact on fatalities and all that, that actually allows us to work much more closely with health. We are ADB is now really focused that we cannot solve health problems with the health sector alone. We need to do a multi-sector approach. We in ADB claim that, I always claim this, that unlike WHO used to be there, that for me to talk to a transport person, I have to get out of WHO, and I don't even know if the Ministry of Transport will talk to me. But in ADB, my transport colleague, Pretty, I could talk to her over lunch. And of course, other development banks have that, but World Bank is too big. They'll get lost in the building. Sorry, I just have to have fun. And even our private sector colleagues is in the same floor. IFC, I don't know whether they'll welcome you. So in a sense, the nature of a development bank, and that's why the discussions right now, the multi-sectorality collaboration is sort of inherent within development banks because we are in one place. We have not maximized it, but we're doing it now. And so we see really great opportunities for us to help you, for example, all those transport people. We could help you quantify the health impact. We could help argue the case why they should put more investment, because health impact, deaths, fatalities are very powerful messages to ministries of finance. And probably a final word. And one of the reasons it is, because this is something that actually affects across, how do we call it, socioeconomic class. This is not something that only affects the poor. Rich people also die from transport accidents. So that actually resonates to a lot of political leaders, to a lot of people who make decisions. So unlike tuberculosis, because it's not a problem, that's only poor people problem. So it's actually could generate a lot of investments, among other things. So we're looking forward to working with you guys. In the next Transport Forum, give us a full session.
Thank you. We could have organized a workshop. Thank you, Dr. Dodo. It's interesting to see even how collaboration and the opportunity to work with different sectors evolves as technology evolves. I would have never expected the space agency to be put together as to work together with road safety. So it's really exciting. This is, I guess, closing out our panel piece to our third component of the session. I don't see the time remaining, so if my colleagues can help by putting the time remaining on the screen, that would be wonderful. And thank you all for, it says 0 flashing. So I guess I'll wrap up at the end, but maybe I can invite my colleagues back on the stage, Johan, Sveta, and Greg, and open it up to the floor for questions to anyone. Please go ahead and take the mic.
Thank you, yes. Jeff Turner, I'm a social development consultant for the ADB, but I'm also a visiting professor at the Institute for Transport Studies at the University of Leeds in the UK. And I just wanted to take up the call that Bui raised. I think we've had 2 presentations that highlighted the scope for GPS data as part of road safety analysis. And you have a partner who is offering GPS data under partnership. I think the question is there an appetite amongst the development banks, ADB and the World Bank, who I know are represented here, to take up that call and make, from the perspective of a lower income road authority or transport authority, the availability of that data will make a substantial change, but it's not affordable or not accessible. Can the development partners have an appetite to step up and make that public good, as it were? Thank you.
Thank you. And may I ask Sveta to answer that question on would development banks have an appetite to work with GRAB, all of the data that they have, because countries don't necessarily have the resources to...
Sure, happy to take that. I love getting more data, so I would love that opportunity to partner together. And one of the things that we've been doing within the iConnect program is developing open source tools. So developing the algorithms to process this data much more quickly so that each road agency doesn't have to necessarily be sitting there trying to figure out, okay, how do I deal with this huge amount of data and where do I even start? Instead, now there's packages that we can develop that can be used and applied to this kind of data. And I think more and more we have these kinds of tools available to us, especially I think it was mentioned earlier with the ability of using AI for coding. That also makes it much easier now and much more accessible for someone that's not necessarily trained in working with this kind of data to make use of it. But definitely I sit in the research side of the bank, and we're very happy to work with partners like Grab to be able to see how we can make that data into useful insights, and then how we can make the code and tools available for road agencies so that they can start doing that on their own and being able to sustainably work with that data in the long run.
Okay. Any other questions?
Mabuhay, I'm John from the Department of Public Works and Highways of the Philippines. With regard to the presentation of technologies on road safety, we can all agree that and recognize the significant potential of AI in promoting safe and sustainable mobility through its predictive capabilities that can support both the policymakers and road users. Now, my question is actually related to level of investment required in operating and establishing an AI-based road safety systems, which basically requires extensive data sets, digital infrastructure, and at the same time, continuous data management. So in your own experience, does these systems really require large-scale investment? And if so, how we can actually implement or deploy such systems, especially in countries that are developing with limited financial and technological capability, particularly in highly urbanized area wherein they are more vulnerable to road accidents.
Colin, would you like to end?
Yep, I can offer up an initial bit very quickly that
We have 30 seconds left.
products like IMAP, but other products as well, have now data marketplaces. So from TRL, we happily take data sets from wherever it comes from, whether it's be weather data sets, whether it's accident data sets, whether it's hospital data sets, put that in the system. You can choose and pick which data set you want and how valid and how relevant it is to your needs, and then use it. So we have Michelin data, we have GAST data, we have weather data, and any company can freely put their data onto this data marketplace to allow road asset management and infrastructure and IMAP users to grab that data and do their assessment so that they can choose whether to use it or not. But the efficacy remains with the data provider, which means they can keep ownership of their data, keep it relevant, and keep it fresh for what you need it for.
Greg, did you want to add to that?
Yeah, I think the presentation that I think Katja did on the first day, where she said a couple of things. One is like, do good projects ahead of the perfect projects, and there isn't just one or two things that need to be done. There's hundreds of things. And I think that applies very well to this situation. I think to build the dream AI that, you know, can do all things and replace all humans, okay, it's millions and billions and billions. But to use AI today to make every little thing that we need to do more accessible or faster or more effective, it's just sitting there for free at the moment. So to give you a very quick use case, here in the Philippines, I can easily grab OpenStreetMaps and potentially grab the DPWH road asset database. I can literally ask Copilot to write me some Python code to convert that into an IRAP assessment specification. Like, I'm not talking months and months, I'm talking hours to do that. And I don't know how to do coding in Python, but I know what I want, and I just tell it and it helps. So I think there's, and much of this data is kind of, I always think it feels like it's just like gold lying around on the floor. Like we can just walk around and pick it up now. Data's everywhere. Like Colin said, the data marketplace is exploding, and a lot of this data is for free. And admittedly, some of it is very challenging to get, but not all of it. And there's a lot of data that you can gather, add insight to, and act on quite quickly. So I think it's, yeah, don't try, in my view, try to do the perfect, just try to do many steps better using the tools that are available now.
think that's a good way to end this panel and Q&A because we have a flashing sign here in front of us. So thank you all. So many good perspectives, such good knowledge on the stage here. Thank you from the health sector, government, private sector, research, other development banks, there's a lot of opportunity for technology to improve road safety, and of course we need to support and work together in order to fully optimize. So with that, I ask everyone to stay on the stage because we need to take a photo, but we also have our moderator do a little closing of the session. Ganesh, I didn't want to cut you off from that role.
Thank you, Preeti. I think you have basically you have said it all. To our presenters and panel, thank you for your valuable contributions. Today's presentation reaffirmed our deeply interconnected collaboration. And as a takeaway, let's translate our today's lessons learned insight into future collaboration. Thank you once again, and I look forward for your continued support. Thank you all.
Please take your belongings with you because the room will be reconfigured during the break. Thank you.